Here we go.
Okay, so welcome everybody. We're so glad you're here. So welcome to our webinar series, Braving BFRBs, Expert Insights on Skin Picking and Hair Pulling. So in this series, we take a closer look at the emotional and psychological experiences behind body-focused repetitive behaviors, or more commonly known as BFRBs, focusing on excoriation disorder, which is skin picking, and trichotillomania, which is hair pulling. So it's led by experienced therapists. These conversations aim to explore not only the science and treatment of BFRBs, but also the very real human stories behind them. We'll dive into practical strategies, effective therapeutic approaches, and supportive tools to help anyone impacted by these behaviors find hope and healing. Whether you're living with the BFRB yourself, supporting a loved one, or simply looking to learn more, this series is here to inform, support, and empower. In today's session, we'll be exploring a powerful and often overlooked aspect of BFRBs, the role of identity and self-perception. So how we see ourselves can deeply influence our behaviors, our healing journey, and the way we respond to challenges. We'll talk about BFRBs, or how BFRBs can shape our sense of self, and how in turn our self-image can affect recovery. So let's begin. So to kick things off, I know our audience would love to get to know the two of you a little bit better. Let's introduce ourselves, go around the gallery. So just to break the ice a little bit, I'll go first. So for those who don't know me, my name is Meryl. I'm the Chief Community Officer, it's a bit of a mouthful, for SkinPick and TrichStop. So I'm responsible for creating communities on all of our platforms, such as facilitating and coordinating our live events like our webinars. And I'm responsible for basically connecting those with lived experience with skin picking and hair pulling to platforms like our program, and also connecting ourselves with other mental health professionals. In an effort to create relationships, to improve techniques and treatment methods, and again, just to create sustainable and meaningful communities. So yeah, and I'm also a counsellor here in South Africa, and I'm really excited and very privileged to be part of this community. I also have a personal experience with BFRBs. So I have two kids, one who picks their skin and another who pulls their hair. So I'm a parent of lived experience, and I have a small window into what it feels like when it comes to having a BFRB in the home. So yeah, that's me in a very small little nutshell and a very brief little window of what I do at SkinPick and TrichStop. I'm sure our audience are really keen and interested in hearing about what the two of you do. Maybe Sofia, you can go first.
Well, thank you, Meryl.
You're welcome.
Yeah, you're doing so many things. It's like almost hard to follow. Such an important part of the team. Yeah, so my name is Sofia. I'm the clinical lead here at TrichStop and SkinPick. I'm a licensed clinical psychologist. And yeah, I think I do quite a lot of things as well for the programs. I do see clients in the program, so I know what it feels like to go through a program. I have a lot of expertise when it comes to skin picking and hair pulling. I also create content. I reflect on how can we best support individuals who suffer from hair pulling or skin picking through evidence-based care. We do our own research here at Helping Minds, the company behind SkinPick and TrichStop. And yeah, and I'm part of our excellent team of therapists, which one of our most experienced ones is sitting here with us, Vedrana.
Yes. I was just thinking, I can't tell so many things about myself. So I'm just this one of these excellent therapists who is sitting here today by chance. My name is Vedrana Mirkovic. I come from Serbia. I'm a clinical psychologist and a psychotherapist here as well. In the last couple of years, I've been working mostly in my private practice and for our BFRB programs, which I honestly I didn't know much before starting the. I actually never had a person who suffers from BFRBs in my private practice who actually came to me saying this is my problem. Some of the people that I see or saw in the past have had these kind of problems alongside some other things they struggled with. So my expertise about BFRBs is actually gained through our work in the program with a lot of clients in the last 5 years. So I'm really happy to be upgraded to the position where you can actually see me and somebody can say this is one of our experts. I appreciate that. Feel proud about that. So thank you.
Amazing.
Yeah, you should be.
So, yeah. So definitely, there's never a quiet day in either one of your worlds. You guys are really super busy and have a lot of responsibility.
And a lot of interesting work.
So our topic today is about identity and self-image. So for those, including myself, we may have a misunderstanding of what identity or self-image is. So just to clear the air and just so we're all on the same page, if either one of you could maybe just help us understand what is identity and self-image, and then what do these actually mean in real life, and why do they matter for someone with a BFRB like skin picking and hair pulling?
Yeah, I'd be happy to talk about that a little bit. Of course, as in many psychological concepts, there's different definitions of what identity is, and I could probably fill like a whole hour and talking about those, but that would be very boring. Um, the way I like to think of it or also describe it to my clients is every person in their heads tells themselves kind of like a story about themselves. And that story is some aspects of that story are stable, some of them might change through experiences, through over our lifetime. The story that I tell about myself might be different from the story that someone else tells about me. Sometimes other people see us differently from what we see ourselves. And it's made up out of many, many different things, like our personality, our experiences, our beliefs, things that happen to us, the people surrounding us. So it's a very complex concept. I think one of the things that I focus on with people is that as you can, tell one story from very different angles, you can also reflect on who you are from different perspectives. So some of the people I work with, and I myself included, sometimes we, for example, tell our stories from a very critical standpoint, right? If that was a story in a book, you would think that the author doesn't like the hero of the story at all, and like looks at whatever they're doing from the worst possible perspective. And then I try to work on that and think like, okay, if someone who really, cared for you and loved you would tell that story, what would be different about it? But yeah, I guess another concept in identity that I find very interesting and important, specifically where we're talking about BFRBs, is what parts of my identity, what parts of my story are based on things that can change, like the people that like me or the success that I have or might not have, how well I'm performing in some area of my life or not. And then if most of your identity and your self-worth is based on that, you're gonna be very unstable in how you feel about yourself. And what our society doesn't encourage us to think about very much is the things about ourselves that make us us, that stay the same. no matter what happens, that kind of nobody can take away from me. I once had a client, and she was like, she's in a very high position at her job, but she never gets it. Like, she always thinks she has this imposter syndrome, right? And then sometimes she says, like, yeah, this meeting did go so well, but like, I don't even know why. I didn't do much. And I'm like, there's things about you that you bring to the room just by being you. That specific individual is someone who makes other people feel comfortable, understood. And that's something about her that she just brings to the room no matter what. And so if we're talking about BFRBs, sometimes if we focus on like, how much did I pull, how much did I pick, if I base my feeling of identity or self-esteem on the beliefs that are focused on our success or failure when it comes to coping with those behaviors, or what also is very common, on the way I look, right? Which can also fluctuate, and you can also feel different about it every day, then the disorder itself can really influence the way you feel about yourself and the beliefs you have about yourself and your sense of identity. So it can really have a negative effect here, but at the same time, because it's because it's always changing, you can also work on that, right? And reverse that and take a different perspective.
Yeah. It kind of reminds me a little bit about, when you introduce yourself to someone, you may resort to, I don't want to call it an elevator pitch, because that's something completely different, but it's just more of like a rehearsed sort of expression. Hi, my name is Sarah. I'm an accountant, a wife, and a mom, and I have OCD. And they're kind of like, that becomes their identity, those certain roles that they have. And I think that can not distort, but it can kind of complicate the way that someone sees themselves. They see themselves as those specific roles. And as you just mentioned, it's way more complex than that.
Yeah. And it really matters the way that you present yourself to others, and the way you present, kind of like tell your story in your head.
Yeah. And for you, Vedrana, is there anything else that you want to add to the concept of self-image and identity?
I don't want to complicate too much, but the part where Sophia like divided to the things that are changeable, this is where therapy kicks in. We can only work on the things that can actually be changed. BFRBs are one of those things. And the things that are unchangeable are a matter of, working on acceptance if the self-image is too negative, which is also, part of therapy, but it's like, there are clients who come to therapy with this idea: only if I change who I am, things will be better, my relationships will be better, my life is going to be better. Symptoms that I have, I won't have anymore, but that's not the point of changing who you are. The point is changing things that you struggle with, and those are two different things. And we are going to talk about that the whole evening, so not to jump ahead.
Exactly. So how then do BFRBs affect then the way that people do see themselves? And do you notice that people start to believe negative things about who they are? And we've already touched briefly on this. But if there are any other ideas or thoughts around that.
Well, from my experience, this connection between self or negative self-image and BFRBs is a two-way street. So this is like the chicken or the egg question. There are people who start struggling with the way they see themselves or they feel about themselves because they suffer from BFRBs. And this is quite normal and expected. And if we go back and look at the clinical, criteria for BFRBs, we have this one that says, a person repeatedly tried to change the behavior. It was unsuccessful, etc. And this, when we are trying to change something and we are, not managing to do so, we start feeling not only unsuccessful, but also start feeling hopeless and helpless that things will ever be better. And if we feel about any aspect of our lives, if we feel hopeless or helpless, and that lasts for some time, of course, that's going to impact the way we see and feel about ourselves. So those are, one type of people that I see, or one type of stories that I hear. Maybe that's more precise. And the other type of stories are people who they have this, older, rooted in themselves idea that they are wrong in some way, that they are not good enough. And BFRBs come as a reaction to that. When I'm trying to live my life, to have a good life, to be a good person, to be a good friend, a good partner, a good mom, good father, etc. But I have this core belief that something is wrong in the way I live or do things. I need a way to cope with that. Because in order to try to be good, I have to do something with this feeling so I can, push through it, so I can skip it, so I can, put it aside while trying to live a good life. BFRBs can also be part of that story. How our tool on how we try to help ourselves not feel as bad, so we could get up every day and do things that we are supposed to do. So this is why I say it's a two-way street and chicken and egg, question, because we can't really be sure what comes first. But the way I see it from in therapy, sometimes it's not very important, but really comes first because people come with all this stuff at once. So when we try to work on this stuff and try to understand if I'm a bad person because I'm pulling my hair, or am I pulling my hair because I'm a bad person, these are like stories that we try to develop and deepen and understand.
So then adding to that, I know that in a lot of our conversations, a lot of content that is shared on social media, a lot of conversations in groups, we often do talk about shame and that experience that people just have, on a regular basis, but particularly after they experience a slip. For those who don't know, a slip is just another term that we use for like a relapse. So how does shame come up, with regards to body focused repetitive behaviors? And can you talk a little bit about why that is and how it shows up in people's lives?
When I talk about shame generally in therapy, and specifically when it comes to BFRB, is I'm going to take a step back. A lot of people who come to therapy, no matter what they're suffering from, they feel like they're having too much of one certain emotion. Okay, like they're too anxious, too depressed, too angry. And then with BFRBs, there certainly is a lot of shame involved. And then I just want to validate it a little bit, because we have all of our emotions for a reason, and we're supposed to feel all of them once in a while, obviously not all the time. And there's basic emotions like fear, anger, sadness, happiness. And then there's social emotions, and shame is a social emotion. You will not feel ashamed unless you're in the company of someone else or imagining what another person would think about you right now if they saw what you were doing or what was going on. So it's not something that we're born with, and in different cultures, we feel shame for different things. But it's basically something that's also supposed to save you from doing weird stuff that will, lead other people to look at you weirdly, and like eventually, like originally evolutionarily, so you would not be kicked out of the group, right? Because you could not survive without your tribe or your group. Yeah, your tribe. We've not changed that much, like our internal wiring. Anyways, I could talk about that for hours also. Anyway, so first of all, validate shame. It's just a signal that something weird might be going on, and you should maybe check yourself. But then when it becomes too much, you're basically starting to hide. You're starting to not express yourself anymore, and you're starting to overestimate how negative other people would react to you, and yeah, that's very common when it comes to BFRBs.
Vedrana?
Yeah, I would like to add to that, this is a great point about how we feel shame in relation to either a person that's really there or a person that we, somehow embodied or interacted growing up. The thing with shame is that often when we do think that it's shameful because we don't want others to see us, we tend to hide. And when we hide, we not only hide that one thing that we are doing, pulling our hair or picking our skin, we are hiding, ourselves as a whole, and we are distancing ourselves from people that care about us or that we care about. And when we talk about shame, we need to talk about this hiding aspect of it and how, as long as we hide ourselves, this is like the thing with any avoidance behavior, that as long as we hide ourselves or we avoid a certain situation that we feel might be overwhelming, we are never allowing the opportunity to see what other people might really see. We are constantly in that same cycle where we expect others to see a negative thing, to shame us, to reinforce shame. We are not allowing others to have a different approach, to approach with kindness, to approach with understanding, to approach with curiosity, to say, it's okay, it's weird. I mean, it's not weird for me, but it's okay if it's weird for you, but it's a thing that's a thing you do. And that can be enough for shame to decrease. But as long as we stay in that shaming, hiding position, we are not allowing other people to actually reach out, to actually take care of us.
It really
Great
is a
point.
spiral.
Yeah. Something that I don't particularly experience myself on a personal level, but I know others that do, particularly my teenage daughter, the role of social media and beauty standards, and how that can just dial up the pressure. Having the perfect flawless skin and the filters that come with that, and the picture perfect locks and all that kind of stuff. So how does this, and does it influence someone's self-image, and what impact do you think it plays?
So I think you could divide that in two questions. Like, first of all, how does social media do, or does social media affect our self-image and specifically our body image? And then how is it, what can we say about this specific interaction when it comes to skin picking or hair pulling? Because I think I was so jealous when you started talking. I'm like, you said like it doesn't influence me that much, so you must have really good social media hygiene, because it certainly influences me.
Yeah.
Yeah, but I'm trying to manage it because I'm aware, but it's also addictive. Anyways, let's put that aside. So social, I think most people are aware of the fact that social media can influence you negatively, and specifically your body image. When it comes to BFRBs, skin picking and hair pulling, then we know from the get-go that body image, and also as we talked about self-image, is a little bit more negative as compared to like a group of people who don't suffer from a BFRB. Especially when it comes to skin picking, the symptom of skin picking is even part of the diagnosis of body morphic disorder, which is a disorder that's defined by finding that something about your body is off. Right. And then this corrective behavior can even be a symptom of that disorder. And then there's a large overlap of those two. So really having negative feelings or beliefs about the way you look and about yourself is part of the disorder for a lot of people. And what I actually asked myself, we did a whole webinar about that, by the way. Someone wants to check it out on YouTube, where I talk only about body image and skin picking or body image and hair pulling. And the reason why that is not that people with a BFRB look worse. Not at all. Okay. That's not the
Yeah, yeah,
reason. We
yeah.
always have this assumption that the better we look, the better we will feel about our bodies.
Mm-hmm.
But that is not
Mm-hmm.
true. Not
Mm-hmm.
generally true. Because if that was true, then people who are very close to beauty standards, just like ballerinas or models, would feel good about them all the time, but good about themselves, which we know
Yeah.
from even from research is not true. Actually, there is a high
Mm-hmm.
prevalence of eating disorders, body dysmorphic disorders,
Mm-hmm.
specifically amongst such people. So a
Yeah.
much more important def- way way to make yourself feel bad about yourself is to just think about it a lot, confront yourself with what you look like a lot. That's what happens with ballerinas and models. They constantly have their
Mm-hmm.
picture taken. A ballerina will stand in front of a mirror for hours and hours a day and look at her body, and then they get criticism. And that's what makes them feel bad, right?
Mm-hmm.
And so people who suffer from BFRBs, they tend to be preoccupied with those things. And it makes a lot of sense if we think about it. I really loved when I listened to one of our past webinars with Claire McKay, when she said it's like our hair and our skin, that's our peacock feathers, right? It's not
Yeah.
irrational to want your hair look nice and your skin look nice, because that's
Mm-hmm.
how you
Mm-hmm.
present yourself to other people. But then once
Yeah.
you are in this cycle of picking and pulling and relief and shame, then you kind of think about it all the time. You're preoccupied with it. And that's what eventually makes you
Mm-hmm.
feel bad about yourselves. That's why also the preoccupation with the mirror, which is a prime trigger for a lot of people, right? Because you look in the mirror a lot, you stand in the mirror, you do your thing, and then you constantly are confronted with the way you look. And that's what actually is detrimental to your body image in the end. That's why also, for example, eliminating that trigger, putting the mirrors away, reducing time in front of the mirror, dimming the light, all those things. It doesn't only help with the behavior, it also helps you just feel better about yourself.
Mm-hmm. Yeah. I love that story about the peacock from
I love
Professor
it.
Claire
I love
McKay,
it.
and
Yeah.
it was obviously so meaningful to her that it's her logo for her brand. So yeah. So as we sort of started this conversation, we alluded that some people can completely associate with one part of their identity, and it can become their whole sense of self. So some people feel that their BFRB, so their skin picking or their hair pulling, is just part of who they are. It's and they're terrified or scared to change because they don't know who they'll be without it. How can someone start to see their BFRB isn't their whole identity? And just to add to this, I've heard quite a lot of comment about people who are really scared to start the journey of healing from their BFRB because they're so scared of losing that part of their self. And they might even, through that journey as well, experience a sense of some type of grief because they're losing that part of themselves that they're so attached to or they so strongly identify with. So again, just repeating, how can someone start to see their BFRB isn't their whole identity?
I've had too many associations listening to you, or the way you're asking these questions, so I'm gonna try and control myself. The most vivid association I had, and this is not to say that BFRBs are childish behaviors, but the most vivid image I had is of a toddler who is having their support animal, and slowly they grow out of it. I had mine until I was teenager. So really slowly, people tend to grow out of things that feel safe for them, that are familiar, that are always there, that are easily accessible. Of course, I mean, I didn't carry it to school. So with age, with working on stuff, with developing understanding, developing rules, you start to understand where some things are appropriate and where they're not appropriate to do or to carry with yourself. It's a similar thing in therapy. Some people also, some clients come to therapy. I just had a client last week and she told me, but you're not going to be here in the next 20 years. I mean, as my therapist. And I said, God, I hope not. I mean, this would be really bad work. But this is the thing, when a person starts therapy, they feel like this is never gonna end. I will always need you, the way kids need their support animal. It's a similar thing with BFRBs. It's okay that you need it now. It's okay that you don't want to let it go. The point of therapy is not letting go, I mean, immediately or because you have to or because you it's about understanding why you need it and how you can work on, satisfying those needs in other ways that feel more appropriate to you. It's not like they're healthy or not. They feel good for you. They work for you. So this is the most, like I said, the association I had, and I think it's okay that people are afraid starting the therapy journey when they're, I mean, no matter what the problem is. And when we talk about BFRBs, they're really specific in a way that they're always there. You can always touch your skin. You can always touch your hair. And you can do that anywhere. I mean, people who struggle with BFRBs for years, they develop strategies on how to do that when they really need it without other people noticing or getting too much attention, etc. So it's something that you work so hard on establishing. It wouldn't be normal if you just wanted to let go of that. That wouldn't, that would be a signal that something is wrong. So it's okay to feel that way and still start the journey, and you do not progress a lot in terms of not stopping pulling or picking in the first 8 weeks or first 15 weeks, because that's your pace. The more you need PFRB, the more it tells us about the suffering that's beneath, that stays hidden. Because we are constantly thinking about how PFRBs are bad. They are not, they have functions. And those functions are what we need. We just need to understand how we can replace it with something that's less damaging.
Yeah, it's
I
like
really no, go for it.
sorry. Yeah, it's like sometimes patients or clients start out their journey with like this really demanding voice in their heads, like you are already you have to be ready already, like you have to work on it now and let go of the behavior and then be done in 8 weeks or whatever. But I really love how Vedrana said like it can take 8 weeks and can take 15 weeks, because that is your pace, right? And everyone does it at their own pace. And I think I really love the metaphor. I've never heard it before. It's so validating of the fact that every behavior is there for a reason, right? Because like many people also come to our private practice or programs and they think like I'm doing this weird thing and I don't know why I'm doing it. And it's like, and again, we're back at the shame. And my approach is always there's always a reason. There's always a sense to it. Nothing is weird. Nobody is weird if we understand where it's coming from and like thinking about it's my emotional support animal, and also the fact that, I mean, let's be honest, some people have their little stuffy until the rest of their lives. They might not carry it anywhere, but they don't want to throw it away. It's still somewhere, right? Because we have an emotional connection to it, but we have to realize at some point in our lives we don't need it anymore. So yeah, I love that.
I just wanted to also acknowledge just what you said, Vedrana, as well. It's such a powerful thing what you said. I'm not going to be able to say it back as beautifully as you did, but just reinforcing and validating someone's experience that they're not ready to let go of that. And I didn't really think about it in that way until you said it. So I think it's really validating for those who are currently going through that and who are really scared, and who don't feel ready just yet, who are thinking, oh, okay, well, that's kind of expected and normal that I'm scared and not willing to let go just yet. So I really appreciate that.
Thank you.
Again, just touching on self-esteem, but in particular, like how does low self-esteem make it harder to manage a BFRB? And do stronger urges show up when someone feels bad about themselves?
Well, for me, this is also a two-way street. And I think that the mediating role in that connection is that feeling of helplessness in front of hair pulling or skin picking. So I think we talked. I think we talked about it a bit more in some of like past webinars that we did together. How helplessness is part of BFRBs. It goes with it, and especially when I work with parents of kids who pull or pick, they often feel, they always feel helpless when they come to us. And I often tell them, but this is what BFRB do. BFRBs do. They make a person who does that feel helpless. So of course, that you as a parent is going to feel helpless because your child feels that they can't do anything about it. So when we define things like that it's not you that you're helpless. This feeling is part of the behavior, the habit. It's easier to, diffuse yourself from what Sofia said, that feeling that you feel like you feel only that one thing, you only feel helpless, and that's it. It's easier to diffuse yourself from that. And to allow yourself to see what other things there are that can help you build confidence before you start tackling the biggest problem. So, for example, if it's a kid, then we can talk about what the kid is good at. We had a special session about that, about the good and the bad dragons. So what the kid is good in, and talk about and dedicate time to talk about that, because this is what builds confidence. You can you can do hard things only when you have enough energy to do that. So I guess this is the point where you can start breaking the bad cycle, is to start talking directly about that feeling.
It's about, I think what you're saying is basically about empowerment. So what can we do to help empower you to then
but it's
take
not,
on this
not
challenge.
what we can do, it's what you're already doing. A kid is already good at math or football. A grown person is already good as a parent. I often also see like adult clients who feel that they're really good parents, except that they are really afraid that their child might pick up on skin picking or hair pulling because they are doing that. And then suddenly they're going to become the worst parents ever because their child is doing something that they don't like about themselves. And this is really a pretty terrified position to be in as a parent. It's also a part of being a parent and a human being. But how are you already a good parent? What are all the good things that you're already doing? This is also you. So if you have awareness on all the good things that you're doing, then you feel more capable tackling the things that you don't like, that are not necessarily really that bad as they may sound in your head. So this is...
Yeah, so I think like on the one hand, those feelings of helplessness that people who have skin picking or hair pulling feel, and then the parents feel it. And I was like, when you said that, I was like, yeah, I feel it also. Sometimes it's a projection, so you sometimes feel it as well. But as a therapist, you know that is normal and expected. I always only say normal. Now I'm gonna go on saying normal and expected. It's normal and expected that you feel what your clients feel, but you can, distance yourself from that or use that feeling to understand them better. But for parents, obviously, it's terrifying, and also like it's much easier. I mean, as a parent, no person you have less distance from than your children, obviously. So yeah, so like that feeling of helplessness can really impact your self-esteem. Because you said, two-way road, reminded me of one of my clients. It's just an example. It actually, I feel like it happens a lot where the BFRB also jumps in when you feel bad about yourself, when you have moments of low self-esteem. So for her, one of the strongest triggers for her picking in that case was when she tackled a new task, and just this moment when you don't know how you're going to manage yet, if you're going to be able to complete it when you don't have a plan yet, when you don't know how to do it yet. That would be when she would just jump off her desk and go to the mirror because it was so triggering for her. So obviously also in that case, the picking impacts the self-esteem negatively, because then afterwards she would feel even worse. But in that moment, it kind of jumps in as a friend to help you cope with moments of low self-esteem. Or when Vedrana, when you said in the beginning, sometimes, people just need that as an outlet for emotions or stress that they're trying to be such a good person all through the day, and then they have no way to just let go or let loose anywhere, and then the BFRB jumps in and helps them with that. So it's really a complex two-way, three-way street, self-esteem and BFRBs. It's an
With the
American
roundabout.
highway with 6 lanes. No, it's complex, and it's important to understand that in therapy.
And just to add to that, I mean, we know that a negative self-perception, or negative moments or memories often seem to be more amplified than the positive ones. We seem to remember those ones a little bit more vividly than the others, or more frequently than the positive ones. And then that can then also have an negative effect on, again, how someone sees themselves, because they're constantly just thinking about the negative aspects of their life, and associating that to the self, instead of not reflecting on the really good things that they're capable of doing, and those good parts of themselves.
Absolutely.
There are many stories that I hear about people who are experiencing hair pulling or skin picking, experiences or activities that they don't get to do because of their behavior. Something that comes to mind, not for me right now because it's winter, but for the rest of the world and the majority of the people that are watching right now, it's summer. And
all the
summer all the lucky ones. Don't worry, it's my turn in a month's time. So so for a lot of people out there, summer is a really difficult and challenging time because they may not be able to experience things that everybody else is experiencing, like going to the lake or the beach, wearing less clothing, exposing their skin, and or things like that. So it just comes to mind of what some people have felt like they've lost, either in those activities, or just lost parts of themselves as a result of their BFRB, and how they can start to rebuild a little bit of who they are, and what can help someone reconnect with the things that they really care about. So I went a little bit a roundabout way in asking my question, but basically, if someone feels like they've lost a little part of who they are because of that BFRB, how can they learn to reconnect with the things that they care about?
I had more than a few clients who struggle with hair pulling, who talked a lot about how much they miss swimming. Some of them were, to some extent, professional swimmers, some not, but it was just something they enjoyed. And how, because of their fear that people will not notice when the hair is wet, that they have problems with hair pulling, they just stopped going to swimming. And one of the greatest, motivators for them to start therapy is trying to bring back swimming into their life. So what we lose can serve us, if we feel like we can get it back, can serve us as strength to change something, so we can get our things back, so we can get our parts back. So this is like the good side of losing important things, is that you can learn how to get them back. Even if you don't struggle with things like skin picking or hair pulling, all of us, because life is that you lose some things, you you stop, playing your favorite sports because you become a parent, etc. So this is what Sofia talked about, how some parts are changeable. We lose things and then we go back to them when we have time, energy, etc. It's a similar thing with this, is that it's normal that we lose stuff and wanna bring them back. In my experience, it's not that the great change doesn't come from stopping altogether with hair pulling or skin picking. The great change comes from accepting that this is where I am now. I won't be here forever. I'm gonna get better, but I'm accepting that I'm here now and I can still do things that I love and live my life the way I want, even though I still struggle with hair pulling or skin picking occasionally, even though I have slips, even though I have bad days or bad months because life gets too hard. So this is this is like for therapy in general, is that it's not that life is gonna become easier. It's life, it doesn't care. It is what it is. Is that is that we can learn how to accept that things are hard and what we can do in certain situations, even if we can't do much. And that's okay. It's just being human.
I love when you added because going back to the swimming pool or things like that, they can be a powerful motivator. But the important thing is really to understand, like, I can do it right now. Like I don't have to let my picking or pulling stop me from doing the things I want to do. And that's why I think well, we know from research that habit reversal training is the most effective way to treat skin picking and hair pulling. But there is but those are very technical approaches, and I think, and we also know from research that some other approaches, like for example acceptance and commitment therapy, which is what we're using here at Skin Pick and TrichStop, are very powerful additional therapeutic approaches, and at least for us here at Skin Pick and TrichStop, acceptance and commitment therapy is the place where we kind of broaden our vision from, like, okay, not only how can we stop the pulling, how can we stop the picking, but also like how can we look at the general picture. And one aspect, for example, is what are a person's values, what's important to me in life, right? So we can switch perspective. Not only, of course, we want to reduce picking or pulling, but also what are the other things that are important to me, and how can I live in accordance to those values? For example, it's important for me to go to the pool, right? What do I need? I don't necessarily need to stop picking or pulling. I can also practice acceptance. Many people who suffer from picking or pulling avoid social gatherings, right? And then that also influences their mood and they feel bad and they're even more ashamed. That is a cycle I can break no matter how far advanced I am in coping with my picking or my pulling. Yep.
Something else that we do talk about in the program and just in general in webinars, we've done a couple of them. I think it just shows how important and valuable it is self-compassion. It might be a little bit of a confusing concept, so we can unpack that a little bit as well. But what does self-compassion look like with BFRBs, and how can someone start practicing it if they're used to being so hard on themselves? So if you can explain, Sofia, just a little bit about, okay, what is self-compassion, and then how we can then incorporate that into our practice.
Sure. So before I mentioned, or I like to mention in general, that we all have a critical, sometimes demanding voice in our head. And self-compassion for me is a way to create a different way of relating to ourselves, a different way to talk to ourselves. And one way to look at self-compassion would be to say it has three elements, okay? Self-compassion is specifically effective in moments where you experience some kind of difficulty or a negative emotion. And so the first step would be to recognize that, even give it a name, but without judging it. Okay, I'm going through something hard. The second would be common humanity, meaning, okay, this is normal to have bad experiences, right? As Vedrana said, it is what it is. Life is sometimes very hard. It's normal and it's okay, and it means that I'm a human being. And then the third one is to
I'm
practice this.
alive. Yeah.
Huh?
I was just saying that I'm alive.
Yeah, exactly. You have a heart, you're alive, and
Yeah. Yeah.
pain is part of being alive.
Yeah.
And then the third one would be loving kindness, a different way to relate yourself and to that pain. Um, just a thought, I just thought about that client that I mentioned that kind of felt really strong urges anytime she started a new task and didn't know, you know, um, what would, if she would manage or not. So for her, if she, for example, were to start to practice self-compassion in such a moment, so she would hopefully mindfully stop and notice, okay, well, I'm about to start a new task. What's going on? Wow, something is going on. I feel
Mm,
stressed.
mm,
I'm
mm,
anxious. Um, Negative thoughts are coming up. For example, you're not going to manage to do that. You will never figure it out. You're not good at your job. All of those critical thoughts. And
mm,
just to notice what this moment is doing to her and notice, wow, this is
mhm,
difficult. This is hard. It's hard for me to be in
mm,
that moment where I don't have the plan yet.
mm, mm,
And then the common humanity would be to say, okay, it's hard, but it's normal. And everyone feels unsure of themselves sometimes, or everyone is anxious, or everyone is afraid to fail. No one likes to fail, right?
mhm, mhm.
And the fact that I care about that the fact that I care about being good at my job, the fact that I want to
Mm,
succeed means that, I'm not indifferent to life. I care and I'm a human being and I
yeah.
have I have my anxieties. And then the third step, loving kindness, would be to, I always have some gesture. I always put my hand on my chest. It just really calms me down.
Mhm,
But there's
mhm,
different things like just try to feel a way to find a way where you feel comfortable in your body, and then try to think what you need to hear right now. What would a good parent,
mhm,
what would a good friend tell you right now? Something like, don't be so hard on yourself. Um, Take a big breath. If you don't manage, you can always ask for help.
mhm,
Um, you've got this, whatever. It's very individual. That's the part that is a little bit
mhm,
tricky and also different for everyone else, for everyone. But yeah, those would be the three steps of self-compassion, at least the way I see it.
mhm. I really like that. And I just wanted to add that we've done a few webinars on self-compassion, but we did quite an extensive one a couple months ago. It was a practical workshop, basically, where we did actual exercises during the session. So I really encourage those who are listening and watching who want to try see what is the self-compassion all about and how can I actually start doing it like right now, to go look at that webinar. If you're not really sure where to find it, you can also just email me and I'll put you in the right direction. One of the practices we actually did, Sofia, was exactly those gestures that you were talking about, the ones on your, we actually did, we tried to simulate a distressing or a stressful experience, and we did that by clenching our fists. And how does it make you feel? And then we also put our hands on our chest. We don't have so much time. I'd love to do it right now, but we put our hands on our chest as well. How does this make you feel? But then also putting our hands out, sort of our palms facing up into the ceiling, and like, how does that make you feel? Maybe a sense of acceptance, or embracing what's coming to you and feeling a little bit
Mm,
more open. So it was a really lovely experience, and I loved what you said, how you added thinking about self-compassion in a way, talking to yourself as if you are a loved one, or a dear friend. So I think practicing self-compassion can be a little bit hard, especially if you've been so critical and ugly towards yourself. It can be really difficult to be nice. So if you can't do that just yet, you can just maybe picture yourself as a young child, or just pretend or visualize that you're talking to somebody else in the meantime. So once you get that rhythm of what it actually feels like to speak in a nice way and what that sounds like, you can start from there. We are heading close to the hour. So I hope everyone has just a couple more minutes because we have two things that I still really want to get to. I don't want to leave them out. So we'll run just a couple minutes over. So in therapy, and this is obviously for Sofia and Vedrana. So in therapy, how do you help someone build a better relationship with themselves while working on their BFRB? So are there any simple exercises for self-image? Again, we've spoken about self-compassion and ACT, so acceptance. Is there anything else, Sofia and Vedrana, that people can work on?
It's always so hard to be short and quick about something. Like having a better relationship with yourself is not something where you have an easy fix, or like I'm a CBT therapist, right? So like we always talk about this tool case. So like I get asked a lot about like, do you have any tools for me? Anything I can do? But having a better relationship with yourself, or if you feel like your BFRB has taken over your life, it's not like there's no easy fix or no specific tool that you can use, just like exposure if you would have a phobia or whatever. But I think in the terms of acceptance and commitment therapy, and kind of taking a step back from your thoughts and switching your focus, then I would say like for a lot of people who suffer from BFRBs, there's so much focus on the picking and pulling, and like it sometimes seems like it's your whole life, and that always reminds me of like how our perception is so easily influenced by where we put our focus. Just like you mentioned before, sometimes we have a tendency to focus on the negative always, and then once we actively try to focus on the positive, we're like surprised, you know, how many nice experiences we have throughout the day.
Yeah.
Almost like you know, if you've I don't know if you've ever experienced that, but if you are you know, traveling and you're in a city and all of a sudden you have to go to the bathroom, and then you're like frantically looking for a place where you can go, and you will probably be looking for a Starbucks or a McDonald's or something like that, and then like all you're looking for is like the yellow M and stuff like that. And afterwards, even if you don't have to go to the bathroom anymore, you will notice every McDonald's that you're, you know, that you're encountering, because your focus is primed on that, right? So if your focus is primed on the pulling and picking all day long, and all the thoughts about it, and all the how can I hide it, then you're gonna, you know, have a bad relationship with yourself. But if you switch your focus, if you open, you know, your eyes and think about other things that are important to you, or in terms of identity, other aspects of your story, and don't only look for the yellow M, then that can really improve the way you feel about yourself. If that makes any sense.
Absolutely. I think that metaphor, and for those who don't know, Sofia loves metaphors, but it's a really great way to explain sometimes complex and difficult concepts. And it just like sometimes lands really well. So I love
Yeah,
those.
and I just got a new one from Vedrana about the toddler. It's gonna go into my
Yeah.
toolcase with metaphors.
Vedrana, anything you wanted to add there?
Uh, just a joke that when clients ask me about what's the solution, I tell them that I have the solution. It's just way too expensive for me to give it to them. And that kind of joke usually helps clients understand how unrealistic it is to assume that something that feels so hard can have such an easy one thing, you know, fits everyone solution. So I guess sometimes, you know, just having a good laugh at the way you feel you can fix. I mean, if it hurts, then it's really hard to stop the pain. And that's it. There's no easy thing about that. So, you know, maybe accepting that it's hard and it's painful. This is the best thing people can do for themselves when things feel overwhelming, I think.
And laughing about it, that's true.
Yeah.
Not about yourself, but like yeah, adding a little humor.
Mm-hmm. So this question is often my favorite part of these types of conversations. I look forward to asking this question because it gives us a little bit more insight into who we're speaking to. So just to wrap up this conversation, what's one thing you'd like someone to remember if they feel like their BFRB has taken over who they are?
Mm,
This is a hard one, Sofia, you know.
that's a hard one.
Yeah, it's a hard one.
And this is the last one.
Yes, yeah. The best thing I can go with is that BFRBs are body-focused repetitive behaviors. And if the idea is to do something that's focused on your body, if we can just stop for a moment and imagine that instead of picking or pulling, our body is trying to get a hug. Even if we don't manage to actually do that, stop picking and hug ourselves, or those things that you two just showed how it could be done, but just thinking about it as our body trying to be hugged, it can change the perspective on how badly we feel after, how harshly we speak to ourselves, how much we are angry for even having urges or these habits. So just trying to understand that this has a lot to do with our body, and our bodies feel good when they're hugged. Sometimes things get messed up, and instead of hug, we do hair pulling or skin picking. But this is why we do therapy.
I really love that. It kind of just made me feel a little bit warm inside, and kind of I wish I could. Do I have an option to make emojis here? Yes, I do.
Hug emoji.
Yeah, I'm looking for that. I want to just hug everyone
I'm kidding
who's
today.
here. I can't find the hugging one, so I'm going to send a heart. So I just want to reach out and just give everyone just a virtual hug. Yeah.
Yeah. And I think in the sentence that you're saying, like the BFRB has taken over. I know that some people feel like they've had their BFRB since they can think, just like the emotional support animal, right? Like I don't remember a time when I didn't have it because but there is a time I didn't have it. I just don't remember it. For a lot of people, they do remember when it came into their lives, and what we do in therapy is also understand why. But just the idea of like it hasn't always been there. It has taken over at some point, which also means there was a time before and there can be an after, Not an after in terms of not everyone reaches full remission, or like some people struggle with BFRBs for a long while, but there is the option of taking control back by learning to cope with it, or by understanding this is not my whole life and I'm not going to let this control my life.
I love that. And that's a perfect statement to end the session. And I just want to say thank you to the two of you so very much for basically donating your time to speak about this really important topic. And I think, Sofia, you mentioned in the beginning, you can talk for a long time about this, and I think we can
I'm a therapist
unpack
after
it
all.
further. So yeah, it's definitely something that we will continue talking about. So I do see there are a couple questions in the chat box. If you do, I am going to look at them after the session. And I think we have already answered a couple of them if you were able to listen for the remainder of the session. And if you didn't get this, there is going to be a recording. And yeah, for those who are interested in the program, if you stayed all the way till the end, we have a promo code to give you. So it's you get $100 off your first month. You can use the promo code webinar100. And if you forget the promo code, don't worry, you can just email us and we will send it to you. Thank you everyone for your time, and we appreciate you, those who are watching, and we hope to see you guys soon.
Yeah, thank you guys. Thank you, Meryl.
You're welcome. I love this little emoji thing. Thanks everyone for all your support and for all your love. We appreciate you.
Thank you.
All right, thank you. Bye, guys.
Bye.